Well, my name is David Bearman, and I'm a physician. I've been practicing medicine since 1967. My first introduction to cannabis as a medicine was in 1959 when my father, who was a pharmacist, and I were talking about alcohol prohibition. And he mentioned to me that in 1928, when he was a freshman at the University of Minnesota School of Pharmacy, that one of their assignments was to make tincture of cannabis. And he said, and we had to be very careful because the alcohol was illegal. And of course, the cannabis was not. And in fact, in the 1920s, American physicians wrote about 3 million prescriptions a year that contained cannabis. But we've all been influenced by what I call the cult of modernism. And what started to happen after the Flexner Report in 1910, which tried to marginalize and did successfully pretty much all aspects of medicine except allopathic physicians. And those other branches of medicine, homeopathy, osteopathy, naturopathy, all of them tended to hold plant-based medicine in higher regard than allopathic medicine. And so as time went on, there was a decreased reliance on plant-based medicine and an increased reliance on single molecule manufactured medication. Anyway, as a kid, I grew up in my father's pharmacy, and I was sort of, pulled in or entranced by the idea that manufactured medications were modern and plant-based medications were old-fashioned. And so I would say that it took me a good 15 years after I originally found out about this. And by the way, there's a book sitting up there, the big brown book, behind the picture of Ed Rosenthal and myself. And that was my father's 1927 Remington's Textbook of Pharmacy. And on page 999 and 1000, it tells you how to make tincture of cannabis, and that is useful as an analgesic and as a tranquilizer. But still, it really wasn't until sometime in the 1970s that I began to appreciate that this plant really had medicinal value and that plant-based medicines were as important, if not more important, than manufactured medicines. And I've always felt that the laws pertaining to cannabis didn't make any sense. I couldn't really understand why we had those laws. One of the reasons why I wrote this book here, Drugs Are Not the Devil's Tools, was to point out that the laws regarding cannabis are just part and parcel of thousands of years' history of using drug laws as a tool to marginalize, discriminated against groups. So I really started getting involved in this in about 2001, that is, in actually doing cannabinoid medicine. But in terms of understanding it, in terms of appreciating its role in history, I taught the first course on psychoactive drugs at the University of California at Santa Barbara in 1972. I taught a course at UC San Francisco that had originally been taught by John Frickman and Roger Smith, who started the Haight-Ashbury drug treatment program, which I later ran for a little while. And then I subsequently taught another course on psychoactive drugs at San Diego State University. So I'm familiar with the history and familiar with sort of the trajectory of what's been going on. So in 1996, you had the people of the state of California pass Proposition 215, which legalized the medical use of cannabis. And the reason that they could do that in the face of the federal law is that the federal government has no authority to regulate the practice of medicine. That authority is reserved to the states, and so they could do that. The federal government uses the fiction that they are controlling interstate commerce as their excuse for continuing to have the Controlled Substances Act, where cannabis is a Schedule I drug. I started the community clinic in Isla Vista, and was involved in the free and community clinic movement almost since the beginning. I helped start the third free clinic in the United States, which was in Seattle, volunteered at the Haight-Ashbury Clinic, and then ran their drug treatment program. But I also started a community clinic in Isla Vista, which is just a couple of miles from where we're sitting here in Goleta, and had a lot of people who used cannabis. As a matter of fact, I did a survey of my patients in regards to their substance use, and 80% of my patients said that at one time or another they had used cannabis. So I was certainly familiar with the recreational use of cannabis, and I did have people who from time to time discussed the possible medicinal use. So when I started doing cannabinoid medicine in 2001, I already appreciated the fact that cannabis was useful in terms of treating nausea, appetite stimulation, and as a painkiller for neuropathic pain. However, the longer that I've been doing this, the more impressed I've been at the incredible spectrum of medical conditions that benefit from the medicinal use of cannabis, and the number of people with very serious medical conditions that I've had the opportunity and the pleasure of trying to help, and in many cases the cannabis has been helpful. So I don't want to go on here ad nauseum.
But can you list those, like cancer, and have you seen it actually help people?
Okay, sure. There's a whole long laundry list of conditions. As a matter of fact, in early 1997, right after Prop 215 passed, President Clinton had his underlings hold a press conference, and these underlings included Janet Reno, the Attorney General. They included Donna Shalala, the head of Health and Human Services, the not very well informed drug czar, General McCaffrey, who, according to Seymour Hersh, was a war criminal in the first Iraq War. And I think Alan Lesher was at that, who was Dr. Lesher was the head of the National Institute of Drug Abuse. And they threatened doctors with loss of their BNDD certification and with an inability to participate in Medicaid. And they also explicitly went after Dr. Todd Micarea, who is the most distinguished pioneer in terms of the medicinal use of cannabis, and he actually had worked for the National Institute of Mental Health and was responsible in the late 60s for handing out grants for doing studies. This was a marriage, though, made in hell because the NIMH wanted the studies to look at the adverse effects of cannabis, and Dr. Micarea, who is the only person I ever knew who had read the entire 8 volumes, 3,300 pages of the India Hemp Commission report, he was interested in taking a look at what the benefits are. At any rate, General McCaffrey explicitly attacked Dr. Micarea and accused him of practicing Cheech and Chong medicine. Now, this is really absurd because Cheech and Chong are characters, they're not real people. We know that Tommy Chong is a real person, and we know Cheech Marin is a real person, but their Cheech and Chong characters were comedic creations, and for a high-ranking official of the government to use that to describe what was well known by thousands of years of history and science is very depressing. And as a matter of fact, the federal government's whole approach to cannabis is depressing and discouraging. They have acted contrary to the wishes of the American Medical Association and other prominent physicians. The longtime editor of the Journal of the American Medical Association, the editor of the magazine Military Medicine, which is a semi-official medical journal for the armed forces. They are also contrary to an editorial written by the editor of the New England Journal of Medicine, contrary to an editorial written by the editor of the Journal of the American Medical Association, contrary to position taken by the DEA's chief administrative law judge, and the list goes on and on. So why is this that we're so passionate about it? It's because cannabis is important in terms of its ability to either stimulate or block the CB1 and CB2 receptors. The endocannabinoid system, that is our own system of cannabis-like neurotransmitters and receptor sites that are responsive to not only our own endocannabinoids but the plant-based cannabinoids, is probably the largest neurotransmitter system in the human body, and it's important in terms of homeostasis. So it's not surprising that cannabis has this enormous range that goes well beyond treating nausea, appetite stimulation, and pain, and goes to treating migraines. Sir William Osler, considered the founder of modern medicine, in the first textbook of internal medicine published in 1892, said that cannabis was the best treatment for migraine headaches. That statement was reiterated by Dr. Morris Fishbein, who was the longtime editor of the Journal of the American Medical Association in 1942. And Dr. Ethan Russo is probably the most knowledgeable person about the medicinal use of cannabis. He's a neurologist who practiced in Missoula, Montana for over 20 years, and for at least a decade was the North American medical consultant for GW Pharmaceuticals, a pharmaceutical company that makes cannabis-based medicine. And he wrote a 60-page article in the Journal of Cannabis Therapeutics on the use of cannabis for the treatment of migraine headaches. He actually tried for 4 years to get the federal government to support or endorse a study to demonstrate the value of cannabis for treating migraine headaches. And once again, another black mark against the federal government in terms of their lack of willingness to embrace science. So the people that I've seen that have been really impressive, a lot of people with neurodegenerative diseases. This picture over here is a watercolor that was given to me by a man with Parkinson's disease. And he is a painter, and he said to me, "Dr. Bearman, I wouldn't be able to paint if it weren't for you." And I said, "I'd like to correct you. You wouldn't be able to paint if it weren't for cannabis, but I'll take your picture anyway." So in addition to seeing him, I have a number of people with multiple sclerosis who I've seen for a long time. There were studies done by GW Pharmaceuticals, this company in England, for a product called Sativex, which is a tincture of cannabis. They grow at least 60 tons of cannabis a year that they turn into tincture. They market their product in 15 countries. The United States is not one of them. And it's used to treat neuropathic pain and muscle spasm related to multiple sclerosis. I also have people who have Alzheimer's disease, and in their case, while it helps their anxiety and helps them deal with the sort of sundowner phenomenon of getting very agitated as the sun goes down, it really provides more relief for their caregivers than it does for them, although it does help their anxiety and helps them sleep. Then I've had people in here that have had hemiplegia, that have had quadriplegia. It helps deal with their neuropathic pain, and it helps in their phantom limb pain. It also helps deal with their depression.
And what about their muscle spasm?
And the muscle spasm, yeah. And then there are people with cancer. Now, there are other cannabinoid medicine specialists who I think have a much greater depth of experience than I do, but there's a couple of anecdotes that I can share with you. One was about a year and a half ago. I was at a political fundraiser. It was a party to do with watching the Academy Awards, and this young man who was in his late 20s, early 30s, approached me about his stepfather, who had throat cancer that had metastasized to the regional lymph nodes, to a rib, and to the liver. and the oncologists that he was seeing had written him off or written off their ability to cure this, and they were going to continue to give him some chemo for palliation but not for cure. So he asked me what I knew about the use of concentrated cannabis, sometimes referred to as Rick Simpson oil, sometimes referred to as Milagro oil, has some other names as well. And my understanding is that you take a fairly large quantity of cannabis, about a kilo, and you do an alcohol extraction and you remove the plant material, and you're left with the alcohol that's infused with the cannabinoids. You let most of the alcohol evaporate, and then you're left with about 2 ounces of thick tarry goo, and you take about 3 grams of that a day for 3 to 6 weeks. This is all, done through trial and error, so every lay healer that does this, I don't know that there are any physicians who are actually doing this because it hasn't been proven by double-blind studies. On the other hand, I do know of physicians who are perfectly comfortable by having a patient use conventional anti-cancer treatment and using cannabis in conjunction with that. Michelle Aldrich is somebody who's been an activist in medicinal cannabis and in drug policy reform for almost 50 years. Unfortunately, she was also a tobacco smoker for the same length of time, and she developed cancer of the lung. And she treated her cancer of the lung with conventional therapy and with this concentrated cannabis. And her case was presented by Dr. Donald Abrams, who's an oncologist at UC San Francisco. And he said, most of the time when people present with these lesions in the lung, we will treat them with conventional therapy, and if that lesion gets smaller, we will then go in and operate and remove what's left. And he said frequently it doesn't get smaller. In the case of Miss Aldrich, not only did it get smaller, but it disappeared, and when they went in to surgically remove what was left of the cancer, there was nothing there to surgically remove. So what Dr. Abrams says, and I think that he's right on with this, is that there's more than enough basic science studies. There was a good review article in 2008 that was put out by the University of Wisconsin, which is where I started my medical school training, pointing out that there are at least 15 different cell types, according to animal studies and tissue culture studies, that respond favorably to cannabis. So at any rate, Dr. Abrams has said there's more than enough basic science evidence and anecdotal evidence to justify doing double-blind studies. And in fact, to the best of my knowledge, there are currently 3 double-blind studies that are either started or trying to get started. One of them is in the United States. It's in San Francisco by Dr. Sean McAllister on breast cancer. He had previously done a breast cancer study with mice and found that the cannabis had been extremely successful. There are 2 other studies going on, both for glioblastoma. One is going on in the United Kingdom, and the other one is going on in Israel. I appeared in a video that came out about 6 or 7 years ago now, so it's a little bit dated, called What If Cannabis Cured Cancer? And that has a number of talking heads, in which I'm one of them, and also has a number of clips from people like Dr. Raphael Mechoulam, who is really the grand old man of medicinal cannabis. He characterized the chemical structure of THC in 1964, and he was amongst a group of scientists who in the late 1980s and early 1990s characterized the body's own endocannabinoid system. So those are, some of the conditions that have impressed me. The most recent one that's impressed me are children that have Asperger's syndrome or autism. And I had previously refrained from seeing too many young people because the Medical Board of California has a very high level of ignorance when it comes to medicinal cannabis. However, I've been moved by the statements of the parents and by the results that I've seen to realize that the medical board would be very foolish to object to something that has helped so many children. And of course we have the documentary that Dr. Sanjay Gupta has done that shows that cannabis is useful in terms of dealing with seizures. And we've known for years and years that cannabis is useful in treating attention deficit disorder. And there's something called the autism spectrum disorder. And some people would put attention deficit disorder on that at the low end and severe autism at the high end. And cannabis has proved useful in assisting people throughout the autism spectrum. Some people it's more helpful for than others, but the parents whose kids have autism have been thrilled with the results that they've seen. Their kids are more focused, more concentrated, less disruptive in school, happier. The reports that I've heard have been almost unbelievable. And I think that's part of the problem with cannabis is that in many ways it's too good to be true.